What diseases mimic Parkinson's symptoms? Imagine trying to find your way through a foggy morning, where several paths look similar but lead to very different destinations. That's often what doctors face when diagnosing Parkinson's disease. Many other conditions can produce similar symptoms like tremors, stiffness, slow movements, and balance issues. Knowing these mimics is crucial for accurate diagnosis and effective treatment. One common condition that can look like Parkinson's is dementia with Lewy bodies. It shares many motor symptoms with Parkinson's, but also involves early cognitive problems, visual hallucinations, and fluctuating alertness. Unlike typical Parkinson's, these cognitive issues often appear early and are more noticeable. This overlap can make diagnosis tricky, but understanding the differences helps doctors tailor treatment plans. Multiple system atrophy is another mimic. It affects the autonomic nervous system, which controls involuntary functions like blood pressure and digestion. People with MSA may have Parkinson-like movements but often respond poorly to levodopa, the main medication for Parkinson's. They may also experience severe autonomic symptoms and coordination problems, setting it apart from Parkinson's. Progressive supranuclear palsy is characterized by early issues with balance and movements, especially difficulty looking down. Patients often have trouble with posture and tend to fall early in the disease course. Unlike Parkinson's, PSB progresses more rapidly and does not usually respond well to Parkinson's medications, making it a distinct condition. Corticobasal degeneration causes asymmetric Parkinsonism, meaning symptoms are worse on one side of the body. It also includes muscle spasms, difficulty swallowing, and sensory loss in the cortex. These features help differentiate it from Parkinson's, which typically affects both sides more evenly. Essential tremor is often confused with Parkinson's because of the tremors. But tremors in essential tremor happen during voluntary movements, like reaching for a glass, rather than at rest. It usually lacks the rigidity and slowness seen in Parkinson's, making it a different type of movement disorder altogether. Drug-induced Parkinsonism occurs when certain medications, especially antipsychotics or anti-nausea drugs, cause Parkinson-like symptoms. These symptoms often improve after stopping the medication, which is a key clue for diagnosis. Normal pressure hydrocephalus is a condition where fluid builds up in the brain, causing gait problems, urinary incontinence, and cognitive decline. These symptoms can resemble Parkinson's, but diagnosis involves brain imaging and lumbar puncture to confirm excess fluid. Wilson's disease is a rare genetic disorder where copper builds up in the body. It can cause Parkinsonism, especially in younger people, and often includes liver issues and psychiatric symptoms. Blood tests and genetic screening help identify this condition. Spinocerebellar ataxias are inherited disorders that can mimic Parkinson's, especially certain subtypes. They may respond to levodopa but also include cerebellar signs like coordination problems, eye movement abnormalities, and neuropathy. Huntington's disease is a genetic disorder marked by jerky movements called chorea, along with cognitive and psychiatric symptoms. Unlike Parkinson's, the movements are larger and more abrupt, not small and slow. Post-traumatic Parkinsonism results from repeated head injuries or severe trauma. It can look like Parkinson's but often comes with a history of injury and may include cognitive changes. Diagnosing Parkinson's disease versus these mimics involves a thorough medical history, physical examination, and sometimes specialized tests like brain imaging or genetic testing. Response to Parkinson's medications can also provide clues. For example, if symptoms improve with levodopa, Parkinson's is more likely. However, many mimics do not respond well to these drugs, helping doctors differentiate them. Understanding these look-alike conditions is essential because treatments vary widely. Parkinson's disease often responds to dopaminergic medications, but many other conditions requiring different approaches. Accurate diagnosis ensures patients get the right care and avoid unnecessary or ineffective treatments. Always remember, if you or a loved one experience symptoms similar to Parkinson's, consulting a neurologist is the best step. They can perform detailed assessments and recommend appropriate tests to find the true cause. Medical science continues to evolve, and each person's experience is unique. Getting a precise diagnosis is the first step toward managing symptoms effectively and maintaining quality of life.